Congratulations, you have a newborn, and everybody's gonna think, is it pink, is it blue? Pediatricians, we think of yellow, especially when it comes to the eyes, because almost every newborn will have yellow eyes in those first few weeks of life. You're gonna probably think, why does this happen and when should we be concerned? So there's two main reasons why the eyes turn yellow in a newborn. The first is often the tear ducts here at the inside of the eye may get blocked. As a result, there's going to be yellow discharge, and this is pretty normal actually. It usually occurs in the first few weeks of life, and the white of the eye should not have redness. So if there's yellow discharge by itself, that's one thing. Yellow discharge with redness could be an infection that needs medical attention. If it is strictly the yellow discharge, probably from blocked tear duct, you can take your finger, obviously if you have long fingernails, don't do this, and rub the corner of the eye trying to open up that tear duct. A warm compress or towel can happen to open the tear duct as well. This is common and usually goes away by 6 months of age. If it doesn't, then we may think of further treatment. So that's one cause of yellow in the white of the eyes. The other is newborn jaundice. So every newborn comes into the world with extra red blood cells. Whether they're formula fed or breastfed, they're going to lose weight in those first few days of life, and those red cells are going to go down in number. So the body has to get rid of the red cells by packaging them up, and as they're packaged, they turn yellow as they're stored in the skin or the eyes. So yellow eyes in a newborn by themselves isn't as big an issue. However, if we've got a newborn who has yellow in the face, maybe down to the belly button, isn't gaining weight, isn't feeding well, isn't having yellow stools, that's a different discussion. So when we look at a newborn, we want to usually see them 3 to 5 days of life, because that's when we're going to see the jaundice get to be the worst. So by themselves, yellow eyes aren't as big a deal unless other things are going on. But yes, please make sure you have your baby checked at 3 to 5 days of life for overall jaundice issues, because too much bilirubin can cause the baby to act differently, either really irritable or very out of it, make him more sleepy, harder to feed, and can even cause development issues down the road. Once they start to gain weight, once they start to get yellow poop, we're going to reduce the risk of jaundice, and the yellowness in the body should go down. Now remember, the yellow in the eyes may stay there for several weeks. I'll see babies at the 2-month visit who might still have yellow in the eyes from the jaundice. But if they're gaining weight, they're developing well, they're thriving, they're alert, I'm less worried about it. So main teaching points: don't be surprised if your baby has yellow in the eyes right after birth. The bigger issue is that potential jaundice, and we want to make sure you have that 3 to 5 day visit to check and then follow up afterwards. If your baby was born early, if your baby had health issues, even a bigger need to have those visits done. So if anything comes up you're not comfortable with about yellow in the eyes, yellow in the body, how your baby's feeding or how they're acting, call Active Kid MD. We are here to support newborns and new parents. We have same day, same week appointments, and we know how to follow your baby and help them develop to start their life in the most healthy manner.